We are looking at standard number 9 at this point, and what we have here is that complete and signed job descriptions for each service provider are available for review. Now, a job description is essentially just as it says. It is basically explaining what that person is being hired to do. In our handouts, we have examples of what a job description might look like. Handout number 15 has an example of personal care assistance. It has the title of the position that you're hiring somebody for, what's the rate of pay that you agreed upon, and what's the unit. Is $11.75 per hour in this example. Then you have a description of what are the different things that you're going to be asking that PCA to do. So you include a brief description of what are you hiring that person to do. Then you have a statement here that says you've all agreed upon it, the employee signs it, and the representative signs it, and it's dated. This is an example of a job description. Again, they're on the CDC website. So you might have something that looks a little bit differently than this. The key parts is, does it have the job description on it? Does it have the job title? And is it signed by the employee and by the representative? And you need to have one of these for each of your employees that's working for you. Handout number 16, you have an employee-directed employer-employee agreement that you need to complete. This is a CDC Plus form that can be found off their website if you look at handout number 16. We did find that it's a little redundant because on this form as well it also references what the work duties are. We did, the CDC Plus program office did catch that, brought to their attention. They might be able to, that's something that they noticed that it is a little bit duplicative because it asks for the job description again. Right now it has to be on there, so go ahead and fill it out. That might be something that they'll take note of for future changes. But basically it's your employee-employer agreement. And you have your employee's start date that tells them when they started working for you and what their work schedule is going to be. Again, a form that needs to be signed and completed for each of the employees that you're doing. There's a second page that has a kind of a checkoff list that talks about the employee responsibilities, and then the signature page. We're looking for both sides of this form, or the 2 pages of this form. Let's go back. We have one more, I think on the bottom there. Handout number 17, we're looking at standard 11 in that review tool that I'm covering for you right now. And handout number 17 is your purchasing plan. This is probably something you're very familiar with. Your purchasing plan is really what outlines and explains for you everything that you've signed on for the CDC program for. You have a monthly budget that you're using. This purchasing plan explains what that monthly budget is and what are the services that you're looking to purchase using that monthly budget. Anything that's on the purchasing plan is how we're going to know when we're out there to see you. Do you have directly hired employees? Are you using any vendors? Do you have cash? Are you using receipts that you're paying out for reimbursement? We'll be able to kind of go over the purchasing plan and figure out what is your plan on CDC. What are the key services that you're using? What codes? It helps us figure out all the other pieces that you need to have on hand. The key part that came out when we did some of these sessions around with families is a lot of families brought to our attention that in their areas, they're not getting a signed purchasing plan back from the area office. And if you go all the way to the back of the purchasing plan, there is the signature page. And what we are looking for in this process is that it is signed by you, the representative, by the participant, by the consultant, and by the local area office. So if you happen to have an area office has acknowledged that they weren't always getting the signed ones back to representatives. So they're going to do their part to try to get copies of these to you. Go ahead, check your purchasing plan, make sure it has all the key signatures that it needs to have. The purchasing plan itself is pretty self-explanatory. Reviewer's going to go through it to make sure that it has all the information. It is the most current purchasing plan of record. Purchasing plans are one of those that if it hasn't changed a lot, it could carry over and even cross years. It's not a form that has to be done every single year unless you're having significant changes that occur in your program. So the important part to keep in is your purchasing plan is that you have all pieces of it and that it is signed and that you do have a copy that's signed by your local area office. And again, if you're missing that one piece, you can go back now, ask them to sign that, they'll put a current date on it, and it will just acknowledge that you noticed that that information was missing in your purchasing plan. Standard number 12 is looking at copies of your current support plan and cost plan. Anyone who's on CDC Plus was on the waiver first. you were on the HCBS waiver program, and you had a support coordinator. Once a year, even though you're on CDC Plus, you kind of go back to waiver world. You do your support plan and you do a cost plan all over again with your consultant. You as a representative want to have a copy of your participant support plan and approved, and we've got that underlined, approved cost plan. Handout number 18 shows an example of what a support plan looks like, and you want to have all the pages, including the signature page with the consultant and the participant. If there's a legal guardian in place, they had to have signed off on the support plan. So those are the key signatures. You as a CDC representative wouldn't have to be signing a support plan unless you happen to also be a parent or a guardian for the participant involved. So you have a copy of your support plan and you have a copy of a cost plan that's on there. And the cost plan is, these are handouts number 18 and handout number 19 is the cost plan. It is a computer generated form. It says the ABC system up on top, and it will show each of the waiver services that you've been approved to receive and their dollar amounts. The key part is if you look all the way to the right on the piece of paper, it says service approved. It should say yes in there. If you have a cost plan where it says service approved and it has the word no, it's not an approved cost plan. Your coordinator may have given you one before it got approved. You also want to look at the date. Cost plans in the state of Florida are always going to run July 1st through June 30th. We're on a fiscal year. Regardless of when your support plan is done each year, your support plan may be done in March or it may be done in November, your cost plan is done every fiscal year. So right around May or June, your coordinator's working to get your cost plan in order, and it gets it approved, and they have to have an approved copy in their file by the 1st of July when the approval comes around. And consultants, support coordinators, are required to give a copy of that cost plan to you. So that's what we're looking as a representative. You want to have your participants' approved cost plan. If this is something that you can't find after you look at this video, call your consultant and explain to them you need your most current approved cost plan. The other thing I want to take the time to note here is that, again, we're covering a review period of 12 months. So we could be going back, and if we are out there, say, in the month of March, you may have 2 cost plans that cover that 12-month period. So if I'm out there in the month of March 2010, there's a cost plan that ran from July 1st, 2010. That's in effect now, but there's also one from the previous year that covers it. So look at your 2 cost plans and make sure that the full 12 months you have a cost plan to cover each of those time periods. More often than not, that's also true for the support plan as well. So it could mean that we're looking for 2 support plans or 2 cost plans to be able to cover the entire review period. Okay, we're getting towards the to the last couple of elements that are on the CDC representative tool that Delmarva has. Standard number 13 references the emergency backup plan is complete and available for review. Handout number 20 is available for you to look at. This is a sample, again that word sample, emergency backup plan, and all the pieces of information that need to be in there. If you have any critical services that are provided on your purchasing plan, you need to have an emergency backup plan. That basically outlines that if this employee doesn't show up for work or is unable to work, this is what my backup plan is. I have an emergency backup worker who can step in and they can do that job if this person's unable to do that. And they wanted to make sure that people had a plan written out. So if there's critical services being rendered, it allows people to have a plan in place as to what happens if somebody doesn't show up for work, gets sick, or something happens. So we're looking for a CDC emergency backup plan. Your purchasing plan doesn't already identify who your emergency backup workers are, and it has that information on there. If you have emergency backup workers, they also would have a signed employee agreement and job descriptions that would have to be on file for them as well. So every situation is a little bit unique. If you have questions on this particular piece of paper, again, refer you to the CDC notebook, talk to your area office person or your consultant to try to make sure that it's clear. But we're looking for an emergency backup plan for any of the critical services that you might be receiving. Standard number 14 is, this is if it's applicable, if you happen to have at any point been put on a corrective action plan, and typically that's going to happen if you had trouble managing your budget. If you happen to go over budget for more than 2 months in a row, and had difficulty with managing that monthly budget, and there may be all sorts of reasons as to why that happened. One of the things the program has to do for accountability is have a corrective action plan that they can put in place. If you're somebody who is under corrective action, we're going to want to see a copy of that corrective action plan. Oftentimes, we don't find a lot of representatives on corrective action, so we're often scoring this as an NA. But again, if it's something that you do have, we're going to want to see a copy of it. Handout number 21 is a sample, an example of the form off of the CDC Plus website of what a corrective action plan is. I think this form has been updated over the years, so it could be that there are older ones in place, but this is the most current corrective action plan that they have on hand. That covers all of the 14 standards and the pieces of paper. And again, each of these handouts are either sample forms, they're taken from the website, examples of what it might look like, or it might be the actual form that you need to have. Use your notebook and your consultant to go through your own documentation and see that you have these things in place. Just wanted to take a minute to talk a little bit about reporting alerts. A Delmarva reviewer, if at any point during their discovery process, and this is true whether we're out reviewing waiver programs or we're working with CDC participants, whatever it might be, if at any point a reviewer uncovers any indication of abuse, neglect, or exploitation, if they have concerns related to medical, behavioral rights, health, safety, and or mistreatment of any kind, our reviewers are mandated reporters. And that means that they may need to, if it's abuse or neglect or exploitation, something at that level, they would be making a call to the abuse hotline, they would call their Delmarva manager, and they would also report it to the local area office. One of the key parts of Delmarva's role in working as quality assurance here in the state is to ensure the health and safety of people that are receiving services. And we sometimes in our discovery process come across things that put people at risk. So we need to have a really clear process as to what we're going to do when we come across that. An alert can be turned on and reporting procedures are followed. I mentioned the word alert when I was talking about background screening. That is considered something that could be putting somebody at risk. So the reviewer could turn on an alert. More often than not, that is the most common alert that we're turning on, is things related to background screening. And folks not having that documentation on hand or having not had their employees screened. But there are other instances that can come across. Our reporting procedures are, if it's something related to abuse, neglect, serious harm, exploitation, something that's of a very egregious nature, they're going to call 1-800-96-ABUSE. We're mandated reporters. Anyone in this field who's doing this work is a mandated reporter. Even if we just see something that's not even related to the review that's on hand, we're a mandated reporter, we're going to have to call it in. Local APD is notified by telephone immediately, and we have what's called an alert notification form that Delmarva has to complete. The reviewer completes it, they send it to their Delmarva manager, who then sends it to the local area office, to ACA, which is Agency for Healthcare Administration. They're the folks who hold the Delmarva contract and who we work for. And then, of course, we also are in partnership with Agency for Persons with Disability. So a copy goes to the Central APD office in Tallahassee, to ACA, Agency for Healthcare Administration, and the local area office. You can tell from where all this information goes to that alerts are pretty serious. We need to have accountability that we report these quickly and in a timely manner, so that if there is anything that needs to be addressed or followed up on, everyone who needs to know knows, and they can begin taking steps to do that. And I've already pointed out a couple of times, missing your background screening documentation, not having that done, is an alert. And that simply means that someone's going to be told right away, and they're probably going to give you a call and work with you to get that background screening issue straightened out immediately.